my team members would have an understanding of where that facility was sitting so that they could garner and provide the best health and QI experience for them. So that led us on a fact-finding mission of how we can get these two systems to talk, which led us to you all, Cazoomi.
Hello again, everyone. This is John, and welcome to another episode of our Unfiltered series here at SyncApps by Cazoomi. Today, we'll be talking to a busy woman who is an operation executive with extensive experience in the healthcare industry, coupled with a master's in the healthcare administration sector, and has also achieved notable success executing strategic projects and programs to advance organizational missions and objectives. So, everyone, Anne Lewis. Hi, Anne. Good to see you virtually.
Thank you for having me.
How are you today?
Wonderful. We're in sunny California, so not a lot to complain about.
That's great to hear, Anne. Well, thank you for joining us here today. I'm absolutely sure that our subscribers and viewers are very excited to hear your success story. So, can you tell us a bit about your background and how did you get started to get where you are today, Anne?
Sure. So I've spent about 13 and a half, almost 14 years in healthcare in the United States, mainly driving performance quality improvement at large healthcare systems. So I came from Cedars-Sinai in California, spent a little bit over 6 years at Rush University and Chicago, and then at Presence Health, which is a 12 hospital system offering cradle to grave services. I took a hiatus from the provider side and spent a little bit under 3 years taking a healthcare IT product company that was a startup from conception to product launch. And so on that side of the house, I became a lot more technologically savvy than I did in other roles, which has been very helpful as I return to the provider space in understanding how technology can enable us to better provide care for our patients and our providers.
That's very cool, Anne. So, and if I could ask you, the role operation executive in this crazy pandemic environment like this, do you wear a lot of hats right now?
There's a that's quite the question. We are currently driving a lot of work in our nursing homes because in the United States it's where we've had the predominant amount of deaths associated to COVID, and so that the hats that we all wear at times are many. Right now we are focused on really providing care for cohorting, infection control, a lot of the things that nursing homes need in order to maintain quality of life and preserve life and reduce the amount of deaths that we're having in the post-acute care space, which really is the burning platform that we have right now.
So I'd like to take advantage of this opportunity to, if you allow me to get more personal, and I mean a little personal. You're a busy woman. I mean, you gotta deal with the life and work balance, right? So how do you handle that one? I mean, family and social life.
That's always very difficult. So I am personally, I am a single mom with two lovely daughters, and so trying to balance that is it's always a juggling act. I think the main thing that I did is I moved to this job at Qsource, which is a quality improvement organization that enables me to work remotely the majority of the time, where when I'm at the hospital, I live there. I usually have a room on either the med-surg unit or the OB-GYN unit that I can sleep in a couple nights a week. And so changing companies enables me to have a better personal control over my schedule to maintain how I can flex in and flex out of both worlds. Other than that, I would say it's just basic organization and prioritization. For me, family always comes first. Nobody ever, in my opinion, looks back on their life and says, man, I wish I would have worked more if they have children. And so it's been a reprioritization from where I was 10 years ago.
Wow, we're very proud to have you as a customer, and I mean that's amazing.
Oh, thank you.
Yeah, that's very amazing. Can you tell us a little bit about the automation played in your organization?
We are using, so for our side, what led us to Cazoomi and to you all was internally, I am driving nursing home work across the United States. So we have so many sites, so many parent organizations, so many states, different state accrediting bodies. And we utilize Salesforce from a CRM perspective to organize ourselves and understand where my resource teams, my operations teams need to be deployed. what touch points that we were having. And then under that, we work with the government for some large funding contracts. And there are a lot of associated deliverables with that we have to make sure that we maintain in order to receive the funds under those contracts. So we have Salesforce for our organization and contact management side of the house. And then we have been using Constant Contact for our mass email efforts, web email registrations, podcasts, things like that. But we were really missing the boat in looking at our contacts and our clients from a 360 perspective, meaning we have one system that's housing a lot of the demographic data about the individuals. We have another system that's catching all of our touch points with that individual, but the two were not talking.
I see.
And so for my team members that are deployed on site across the United States, they were walking into nursing homes with no understanding of if other people at our company had talked to them. Have they logged in? Have they looked at our podcast? For COVID in particular, have they downloaded the CDC toolkit? Have they tried to train their staff? What are their infection control policies, and what tools of ours have they utilized and implemented so that my team members would have an understanding of where that facility was sitting so that they could garner and provide the best help and QI experience for them. So that led us on a fact-finding mission of how we can get these two systems to talk, which led us to you all, Cazoomi. And so we were able to implement that integration, and it's just been a game changer for those individuals in particular that have to go into the facilities. At the frontline level, you have to think about nursing home staff. They have been dealing with 2 years of death, of regulations that have been coming down left and right, of state surveyors that on top of that come in and fine them. They have the highest turnover that industry has ever had in the history of the United States right now. So they constantly are either short-staffed, having agency come in, or not having enough staff to meet the needs of the residents that they have. So my point with that is they are really, really taxed and they are tired, and time is the most precious commodity. And so enabling our team to be able to have an understanding and do the background and legwork before they walk in so that they can provide exactly what those individuals need at the right time without having to go through discovery and ask them questions and a lot of things that would impede on their time has just been, I can't tell you how well it's been received by our nursing home providers in particular. When they look at other QIOs that are doing similar services, their comment consistently is, when we hire Qsource, they come in and they don't know just what we need, they know who we are. And it's been purely because of this integration, our ability to take the two systems and combine them. And then for me, from the executive side, when I go and report to the board of our activities, having the ability to take the analytics that come with this integration of what is our marketing outbound outreach look like? What does that look like from an ROI compared to the contracts and the revenue that were coming in? But what does that look like from a quality perspective with how many providers that we have reduced mortality rate, that we have implemented their employee vaccination rate and decreased hesitancy, which then has led to resident mortality rate going down. So it is really provided on the executive side for me the ability to show and highlight the entire picture of the work that we've been doing. And the really big picture with that is with our government contracts, we then have to submit that information back to CMS, back to the state departments of health. And because we've been able to do that consistently and have this extra level of data that really other QIOs that compete under these contracts do not have, when there have been modifications that have come down for that contract, meaning more opportunities to do more work with more revenue associated with that, we have been the company of choice, which that is benefit to everyone. Helps the providers, puts more money in our pocket, helps us continue to further the work that we do under the mission that we all care so much about.
Wow, that was very detailed, Anne. So yeah, that was very detailed. I mean, thank you for that information. So in your case, Anne, does it helps you save more time and focus on your business right now?
And it helps us to be very targeted in the interventions that we go in with, which from our side it's a time saver. On their side, it's a time saver. But the bigger picture is from a quality perspective, when we're able to understand this facility has had these touches with us, they've looked at these resources, coupled with the contact management side where we say, here's their beds, here's their mortality rate, here's their ADC. when we combine those two, it creates this powerful ability for the team to say, these are exactly of the, probably 80 some interventions that we have. These are the 4 that this facility needs. And so it just enables us to go in and be very targeted in our approach for exactly what the root cause of that facility is that needs to be addressed. But then from a time perspective, my internal team is not sitting there and trying to comb through 80 some different modules, interventions, evidence-based clinical pathways and say which one, where should we start on a site-by-site basis. So it's really been allowed us to target our interventions in a way that we wouldn't have otherwise.
Where did you heard about SyncApps? I mean, is it word of mouth, or did you see some ads, something like that?
I honestly think it was just straight research.
Mm.
I have an analyst on my team, but she's a wonderful individual, very unique. She's a social worker by background, but then went back to school and got a degree in data science, and then went and worked for our large EMR systems, so for Epic and for Cerner. So she has a very robust background when it comes to data and technology. And so I tasked her with this is not working. This system is broken.
I see. Yeah.
Help me find a solve for it. And I think she just did straight research, and that's how she was found you all.
I see. Yeah. Thank you for that. So using Salesforce and Constant Contact, is Qsource is now more profitable and stays ahead of the competition with this functionality. Absolutely. And helping your teamwork with more healthcare facilities?
We are able to provide analytics that none of our competitors can. I mean, combining those 2 data sources into powerful dashboards and visualizations, we use Tableau for our visualizations, but being able to combine those data sources gives you a 360-degree picture that we wouldn't have otherwise. So it's definitely been a game changer. It's something I'm very passionate about. And the timing of this was serendipitous in that I had a team member that for whatever reason did not realize that the integration had occurred. Not exactly sure how that happened yesterday. That email and said, I'm still exporting lists and doing pivot tables and doing one-off research to try and figure out what I need to do when I go into these facilities. There has to be a better way. And it was so funny. So I'm like, well, there is, and we've already done it. You're just looking in the wrong spot. And wow. So directed to the right landing page where we house all of this. And she wrote back and was like, oh my gosh, how have I not seen this? So yeah, it's definitely been a differentiator. And then when you look at the market that we're in, particularly on the government side, we compete. And part of that is submitting bids about our cost structure. And so having an integration between the two has enabled us to keep from a technology standpoint, our cost structure for the IT component of those bids that we have to do stays low. Because the alternative that we were looking at is, do we either build ourselves internally a comprehensive system, or do we try and find a platform that has that? And frankly, there really is not one universal platform that offers exactly what we were looking for that was cost effective. The only real true kind of integrated system would be Salesforce with Pardot from the marketing component and bringing their analytics in, but their price structure really is not something that we could sustain and still be able to be competitive in our government bids. Yeah. And so having this solution that solves the problem is easy. It doesn't change the end user system. So that's the other thing that I would say is pretty big, is the people that were doing the work, they didn't have to do anything different in their workflows other than look at one landing page so they could see the data. When it came to entering their contact information, looking at their interventions, having their email blast go out, having their podcast analytics sit in a spot, their end-to-end workflows didn't change with this integration. It was just the back end that we had to fix and then direct them on the right place to go. And so all of those attributes are what really for us makes this a game changer. And it's something that our competitors have reached out and asked how we're doing, which we have been more than happy to share. If they've executed on it or not, I don't know. But
I see. That's great. That's great to hear. And then, will you recommend this the integration and use it again for the future business automation, or will you use another one?
No, I would. And I'll say, with my experience, particularly when I was at VOV, I got to know software and the vendor market in the United States pretty well. And something that your company has offered that is very, very few and far between is your support is stellar. You all respond very quickly around the clock. I think I spent 2 hours on the phone one day trying to comb through some like crazy ideas that I had with a gentleman in the Philippines. And we just sat and were spitballing and brainstorming ideas together. And to have that kind of a thought partnership and the timeliness of support is unprecedented in the vendor market here, coupled with it's not an additive fee, which normally is what you see for that level of support in the United States.
Yeah, appreciate that, and yeah, because that's what really SyncApps wants to have, to provide a better support team, so that we could always assist every subscribers and every points that they wanted to be to have here in our platform, man.
It's amazing. And there's every individual that I worked with or traded emails with, on your side, you all keep it very similar. So it's one touch point. So it's easy for the end user to understand. But all the various touch points that I've had with people at your company, they just wanted to make sure that my problem was solved. And however that your system could help solve that problem. And again, that's just not something that I experience with vendors on the support side, that commitment to making sure that even if what is there today doesn't solve the problem, how can we think outside the box and utilize the system that we have and now this integration to solve that problem? So it's been great from the support side, but it's been also wonderful to have that thought partnership.
I see. Yeah, that's great to hear again. So, any thoughts about the constant contact automation API that is missing from the automation and how you
They
all
have
would?
to do it.
Yeah.
They have to do it. I have used Constant Contact now for, I'm going to age myself, I think 8 years. And it's a wonderful product. They are definitely dominant in their size of that market, meaning that the type of revenue sized facilities that they go after, but they're not going to be competitive if they don't turn that on, because every other system is offering that. And if they don't already, and frankly, from a business model perspective, I don't see the benefit of not offering that. And it's something that I've reached out to the constant contact reps about. People on my team have done it. We've done it for over 2 years, and we're one company. And if we have that need, there are definitely many others that have that need. But from a business standpoint, I just don't know why you wouldn't move forward with that. It's not a hard from a production standpoint. So I really hope that they do. And I hope that with they were acquired a year ago, I believe. I'm hopeful that with that new leadership, we'll start to see the importance of listening to their user field and what problems that they have come up and that come up over and over again, and start to put together plans for how they go about tackling those. But we have tried ourselves. We have had no success.
I see, and I think this would be a great video also to watch for their side, because I think it brought to them that it needs to be enabled, right? Because there's a lot of user, not just you, right? But because Constant Contact is also a big company, so I think most of them can watch this video and they might think that it really needs to be enabled, right?
I don't know. We've been working with that company for a while, and every time we try and bring it up, we get more or less just the door is shut. We're not even considering it.
Oh, I see.
Again, I just find very strange because they are very user friendly. So their user experience is wonderful for what they do, but it's 2022. The days of marketing being a one-off email or a one-off something are gone. Automation has to occur. We are trying to deliver healthcare at as low of a price point and cost infrastructure as we can. And if I can't enable technology to do that, whereas I have to have more bodies in order to do things, that's not a software system that we're going to be able to maintain a long-term partnership with, because it's not scalable or sustainable.
I see. Yeah. I'm just blown up after you say that, and but that's a great idea to share about today, and so I think that's a wrap for now. And I really had fun talking with you, and it's really been cool having you here today. Thank you very much. Looking forward to have you again in our Unfiltered. And yeah, and again, guys, feel free to like and subscribe Unfiltered so you don't miss any updates. And thank you very much, and have a great
Thank
day.
you. You too. Bye-bye.